This video was created for you to prepare for your surgery and help you understand your pre- and post-op instructions. If you have questions, I encourage you to pause the video and write them down. We want to be sure you have all the information you need to prepare for your surgery and your recovery. For this first part, please follow along on your sheet titled Preoperative Instructions, General Anesthesia. Please be sure you understand the time that you are supposed to report to our office or the hospital on the day of your procedure. We all understand that the Charlotte area can have some heavy traffic at times, so please make your travel plans accordingly. Typically, we need you to be there on site 1.5 hours prior to your scheduled procedure. Also, there are times when patients have to reschedule their surgery on the day of their surgery due to illness or other factors, so please be available to come in earlier than scheduled on the day of your surgery if necessary. Vitamins. Take a good quality multivitamin with minerals, vitamin D and vitamin C starting 2 to 4 weeks prior to your surgery and for at least 4 weeks after your surgery. For vitamin D, take 5,000 international units of vitamin D3 per day. For vitamin C, I recommend the Ester C formulation. Please take 500 to 1,000 milligrams 2 to 3 times a day with meals. Nutrition. Eat plenty of fruits, veggies, and lean proteins. We recommend drinking good quality protein drinks 2 to 3 times per day starting 2 weeks before surgery and for at least 2 weeks after. The goal is about 80 milligrams of protein per day. Drink lots of water, especially the day before surgery. Do not try to diet and lose weight right before surgery because this may put you in a weakened condition. Avoid diet pills, energy drinks, products containing aspirin, fish oil, Motrin, Aleve, Advil, ibuprofen, and all herbal supplements for at least 2 weeks prior to your surgery and 3 weeks after. If in doubt, ask us, your primary physician, or your pharmacist. You may take Tylenol. Avoid smoking, secondhand smoke, and all nicotine products for at least 4 weeks before and after surgery. No alcohol for at least 48 hours prior to your surgery. This may interfere with the medications used during your surgery and may result in the cancellation of your procedure. It can also cause excessive bleeding. Consider taking an over-the-counter stool softener starting a day or two before your surgery and then daily when you're on pain medications. This is because anesthesia and pain medications may cause constipation. Bring all your medications to the office the day of your procedure in case we need to review them with you. Do not eat any solid foods after midnight the night before your surgery. This is done to prevent you from vomiting as you go to sleep. Compliance with this is very important for your safety. Your surgery will be canceled if you do not follow this simple but important rule. You may continue to drink a small amount of clear liquids from the following approved list up to 4 hours prior to your surgery. Approved clear liquids include water, apple juice, white grape juice, cranberry juice, bouillon, tea, black or sweetened coffee but no creamer, sodas, and sports drinks. Nothing by mouth 4 hours prior to surgery. You may brush your teeth within that 4-hour preoperative period. Wear comfortable clothes the day of surgery, preferably a blouse or shirt that buttons up in the front and loose pants or shorts. Blue jeans and t-shirts are very difficult to put on after your surgery, and they are restrictive in nature and are not recommended. Bring a swimsuit that you would actually wear if you're having a body contouring procedure so we can determine where to hide your surgical scars. Do not wear any makeup, jewelry, body piercings, or contact lenses the day of your surgery. All makeup must be removed prior to surgery. Do not bring valuables, cell phones, jewelry, or purses unless you leave them with the person accompanying you on your day of surgery. We will need a urine sample upon arrival to the office. You will be in the recovery room for about an hour after your surgery to ensure that you are stable. The length of time depends on when you become fully awake. You will need to arrange for a responsible adult over the age of 18 to drive you home following surgery and stay with you for at least 24 hours after your procedure. Since you will have several medications during your surgery, you will not be allowed to drive yourself home, nor will you be allowed to take a taxi cab or Uber. We ask that you leave a phone number of the person who will be driving you home. we suggest you do not drive for 1 to 2 weeks after major surgery. Do not drive while taking the prescribed pain medications, such as Lortab, Percocet, Nucynta, Valium, or hydrocodone. Arnica is used to prevent bruising, swelling, and soreness. Do not eat, drink, or brush your teeth for 15 minutes before or after taking the arnica. Do not touch the pellets with your hand because this will inactivate them. Turn the cap and let the pellets fall into the cap, then drop the pellets under your tongue. The arnica dose is 3 pellets under your tongue. Take the first dose the night before surgery. Take the second dose the morning of surgery. Take the third dose when you arrive at the surgery center. Take 3 more doses spread throughout the afternoon and evening after surgery. Then for 2 more days, take it 3 times a day, and then stop taking the arnica after 3 days, or it may result in increased tendencies to bleed or bruise. These are your general pre-op instructions. Now we will discuss your general post-op discharge instructions. Please follow along the discharge instructions for your specific procedure. Be sure to pause this video and write any questions down that you may have. General anesthesia. You may be somewhat sleepy for roughly 12 to 24 hours after you receive general anesthesia. We encourage light activity with assistance. Fatigue may persist for 24 to 48 hours. Do not remain in bed because it increases your chances of blood clots. A responsible adult should remain with you for at least 24 hours after your surgery. Once your surgery is over, it's very important that you take some steps to optimize your lungs. Often after surgery, patients are afraid to breathe normally because of discomfort. If your lungs are not expanding fully and the commonly produced secretions cannot be expressed out, then complications such as pneumonia can occur. Therefore, we strongly recommend that you deep breathe and cough every hour while awake after surgery. Once you feel like eating, start with bland fluids like Jell-O or soup. You may advance to normal diet as tolerated. Headaches, vague soreness, or stiffness are common side effects of anesthesia and may persist for several days. A mild sore throat is not uncommon for 24 to 48 hours following a general anesthetic. You may use throat lozenges. If you're unable to urinate 6 hours after the last time you urinated, call us. If you wait too long, your bladder may overstretch, resulting in permanent bladder damage. If our office is closed, please proceed to the nearest urgent care or emergency room in order to have a catheter placed in your bladder. For the next 24 hours, do not drive a vehicle, operate any complex machinery or equipment that requires focusing and concentration. Don't consume any alcoholic beverages or medications other than the ones prescribed by us or your primary physician. Don't sign any legal documents, make any major decisions, or major purchases. If you have any questions or problems that are related to your anesthetic, call us here at my office. Medications. If you are prescribed an antibiotic, please start taking it the night of surgery and then as directed. If you have drains, please continue to take the antibiotics until the drains are removed. Take the pain medications as needed. Be sure to eat first. Take the nausea medications as needed as well. Take the arnica as directed on the preoperative instruction sheet. Take Valium or other muscle relaxers as needed for sleep or for muscle tightness. Avoid Motrin, Aleve, ibuprofen, aspirin, and herbal supplements for 3 weeks after your surgery. These medications can increase your risk of bleeding. Do not mix alcohol and pain medications. Use a stool softener daily. Avoid constipation. Feel free to take any over-the-counter medication that works for you so that you don't go more than 2 days without a bowel movement. Activity. Report any extreme one-sided asymmetry caused by swelling or bruising. After surgery, light activity is recommended. Avoid strenuous activity, including housework, exercise, or sexual activity for at least 3 weeks. Avoid driving for 1 to 2 weeks. Do not drive after taking any pain medication or sedatives. Avoid lifting over 25 pounds for at least 3 weeks. Ask us if you have any questions about any physical limitations with respect to your procedure. Typically, we recommend that you avoid sleeping on your side for 1 week. Avoid smoking, secondhand smoke, or any other forms of nicotine for 6 weeks after your surgery because this will slow the healing process. Drink plenty of fluids. As mentioned above, please call us if you are unable to urinate 6 hours after the last time you urinated. We want your experience to be a pleasant one and hope this video has been informative. Please do not hesitate to ask us if you have any more questions. We look forward to helping you achieve your desired appearance. Thank you for watching.